All right, here we go. This is our last lecture for our Psych 1 class. Little sad about it, but there's nothing to do but plow ahead. Today we're talking about therapy. Our most recent lecture was about psychological disorders. It took us a long time to go through all those psychological disorders. And one of the things that I think is the most important thing to say immediately after that is that psychotherapy can help. Psychotherapy is effective. Research tells us that regardless of the approach, when you study studies of thousands of studies of many different types of psychotherapeutic approaches have shown that that these approaches can relieve symptoms of psychological disorders when compared to the control. So getting some help is better than doing nothing, right? Also, in this research, 75% of patients showed measurable improvements after 6 months. That's roughly 24 sessions of treatment. So, most, but not all, are helped in psychotherapy, right? It's worth trying. We're going to talk about 3 basic types of therapy: talk therapy, behavioral therapy, and biomedical therapy. And we will just walk through each one of these sections. First of all, talk therapies. The granddaddy of talk therapies is psychoanalysis, as initiated by Freud, Sigmund Freud. And as you have learned throughout this course, Sigmund Freud is associated with the unconscious. He basically held that there's unconscious parts of our mind that contains ideas, memories, desires, or thoughts that have been hidden or repressed. They've been repressed or hidden because they are psychologically dangerous. They're threatening to our self-concept, maybe at odds with society at large. To protect our self-concept, we automatically build barriers that we can't voluntarily remove. We can't just decide to remove them because we don't even know we have them. The presence of these threatening thoughts and desires give rise to conflicts, and these conflicts can result in psychological and physical symptoms and mental disorders. That's the basis of the psychoanalytical approach. So here I just have a picture of psychic conflict. These are people singing in church, and who knows what they do at night in their bedrooms or, wherever. Like the fact of the matter is humans have drives and impulses and aggression and all sorts of secrets, and they put on a different face for society at large so that it's acceptable. Freud said it's this psychic conflict that gives rise to our psychological problems. Now, since we can't be consciously aware of these, according to Freud, they've developed different ways of surfacing these unconscious processes. One is free association. This is just whatever comes out when you just talk. So just talk for an hour, the psychoanalyst would say, and they would listen and listen. There's also dream analysis, the idea that there are symbols and storylines in your dreams that are related to your unconscious processes. Also, psychoanalysts, they analyze resistance. So if we're in conversation or we're working together therapeutically and you say, oh no, I would never do that. Absolutely not. The analyst might dive right in on that point. The things that you reject or fight against may be the things that are the biggest clues to what you're hiding from yourself. And lastly, analyzing transference. So your feelings toward your therapist, sometimes they might be love feelings, sometimes they might be anger, but your feelings toward your therapist are often related to feelings that you may have to other people in your life. So those are all ways that psychoanalysts try to get at the unconscious. One little bit more about free association. This is the theory that states that everything you say and do is significant clue to your unconscious. So if you accidentally say, I can't think of a Freudian slip. It's where you accidentally say the word that you really mean, but I wish I had prepared one. It's too late now. But anyway, you're not consciously aware of the Freudian slip. If I come up with one later, I'll pull one up. Here is a link to a video which I'm making available to you. You might want to watch it now, where psychoanalysts are describing psychoanalysis. I am not a big proponent of this approach, but that doesn't mean it doesn't work. And that doesn't mean that you shouldn't take it seriously. So I want to make sure that you watch this video. It's also kind of weird and freaky and really interesting. I want to make sure that you watch this video so that you can get a sense from people who use this technique to help people, so you can hear from them what they do to help people. There are limitations of psychoanalysis. In traditional psychoanalysis, you have to go like 4 times a week or 5 times a week for an hour or more, and it can be time consuming and expensive because you're just talking on and on and on, and the analyst is trying to discover clues to your unconscious and interpret them for you. Also, this approach is very difficult to study empirically, and many people believe that there's an overemphasis on the dark forces in your life, such as your sexual and aggressive impulses. There's an overemphasis on the impact that those have on our behaviors. Other psychologists have recognized there are many, many more reasons that we do the things we do, and they're not always that dark. Okay, so moving on to the psychodynamic approach to talk therapy. This is just sort of, it's a newer group of talk therapies that focus on a conscious process and current problems, more so than your unconscious conflicts and your childhood influences. So this is briefer, it's more direct. Like, these therapists are going to get more to the point, and it's a much more modern form of psychoanalysis. They're not going to sit around and wait for your unconscious to reveal itself. They're going to say, what do you care about? What problems are you aware of? And let's work on them. So one type of psychodynamic therapy is humanistic therapy. Now, we know about humanism. We've been studying it. We've heard about Maslow and the hierarchy of needs. We've heard about Carl Rogers and his emphasis on unconditional positive regard. And here we have a video of Carl Rogers interacting with an actual woman with a real problem. And you can see how he does his warmth. Essentially, his underlying belief is that everybody wants to be the best they can be, that they want to self-actualize. They want to feel good about themselves. They want to have a self-concept that is in happy union with their ideal selves. So Carl Rogers says this arises when people show up to a therapeutic environment that's warm and supportive. So for Carl Rogers, empathy is important. Unconditional positive regard. I'm always going to assume the best about you. As a therapist, I'm going to be genuine. I'm going to actually get in touch with my own real feelings and be a real person for you to interact with. And I'm going to engage in active listening. That means I'm going to try very hard to understand what you're actually saying. And I'm going to mirror back to you what it is I heard you say. And so these are important aspects of this type of therapy. I want to give you a little sidebar, a little sort of visual about what is active listening. It requires being attentive to the other person, asking open-ended questions, not yes or no questions. Were you happy about that? That would be a yes or no question. Yes, no, versus an open-ended question. How did you feel about that? Because maybe they weren't happy, etc. Ask probing questions. Can you tell me more about what led you to that conclusion? Although that sounded judgmental, I could even tell in the way I was saying it. You can request clarification, like, I'm not sure if I got this right. I think you said blah, blah, blah. You can paraphrase. You can be attuned to reflect the feelings. So not just an automatic robot who's parroting back what you said. This is what I heard you say. It's like, I heard that you're really upset about that. And show that it actually means something to you that they're upset. and summarize what you hear. So all these are sort of like the key elements of active listening. Now, if we were in class together, I would have you divide up and I would have you actually do an active listening exercise. And in past classes, when people have been in classes, and I've asked them to say, what have you learned in this class that has made the biggest impact in your life so far? When I ask them at the end of the semester, many of my students say it's this exercise that meant the most to them. So what I'm going to ask you to do is to do this in your own life. So all you need to do is to get somebody to sit down and ask them to tell them about something that's on their mind. What's a decision that they need to make? And then just have that person just start to talk about it. Maybe you can even do a timer. Let's just do this for 2 minutes and I'm just going to listen. Or maybe even 1 minute. When the speaker is done, now you, my student, I want you to be the listener. So you're listening to this other person talk about it. When they're done, I want you to say back to them, what I heard you say was, and just repeat back what they heard. And then ask them how it felt. How did that feel? When I do this in class, people are amazed. This is the simplest thing in the world, but sometimes it's really helpful, especially when someone is just trying to make a decision and trying to hear what it is that hear themselves think. You can be somebody who helps them do that. All right, moving along. So we just did humanistic therapies, which are about recognizing the person on the inside and how they feel about themselves. But cognitive therapies are really honing in on your thought process. Sometimes you may have thoughts that are irrational, that actually you can use your reason to change your thinking. Cognitive behavioral therapy and rational emotive therapies are two of these types of cognitive therapies. Among them all, I'm going to invite you to watch this film. It's the same woman that was talking to Carl Rogers, but now she's talking to Albert Ellis. And you can start it at 7 minutes in and skip around and watch to the end. But what you can see how this woman is interacting entirely differently with Albert Ellis than she did with Carl Rogers. Ellis is all about her goals and all about reason. You'll see, you'll make your own opinions, but I'd like you to watch them so you can make the comparison. And this video is about Aaron Beck, and he's just talking about the importance of the relationship between the therapist and the client. And you can get a little picture about how he's thinking. If you go out and seek therapy nowadays, you're probably going to find somebody who does cognitive behavior therapy. It's effective. Research has shown that it actually makes a difference. This has been researched therapeutically, and one of the reasons why it's effective is because it identifies cognitive patterns of thought. And here we have some common patterns of thought commonly found in depression. For example, people who are depressed often focus on the negative while ignoring the positive. In cognitive behavioral therapy, your therapist may be listening to you talk about your day and point out this faulty thinking pattern. Another one is overgeneralization, making sweeping conclusions. Oh, they didn't call me back. No one ever calls me back, right? That's an overgeneralization. Polarized thinking, thinking of things as either totally good or totally bad, or magnifying small problems while even minimizing important ones. Like it's a big problem that I can't find my car keys, while minimizing the fact that you haven't showered for 3 weeks. And blaming yourself for things that aren't your fault. So what might happen in a cognitive behavioral therapy is you would be talking about your life, and the therapist who's trained to recognize some faulty thought patterns might point them out to you and help you question that thinking. So there are 3 C's of the cognitive approach. That involves catching your thoughts, challenging your thoughts, and then changing your thoughts. So, catching a thought like, that's so terrible. That's completely bad. When he told me that he thought that I wasn't ready, he was so bad, right? So I might catch myself and say, oh, actually, maybe it's not all bad. Maybe he was actually trying to help me. I'm now challenging the thought. Is that true? And then I'm changing the thought. Oh, he's not out to get me. He's actually trying to help me, even if he was a little bit rude about it, right? I just went from having an enemy and really having an anxiety producing, anguish producing thought to, oh, okay, I can see the world a little bit more level now. So here's another video that I'm going to invite you to listen to. This is Judith Beck. She's the daughter of Aaron Beck, who came up with cognitive behavioral therapy. And I really like this video. I just want you to listen to it because this is like a training video for therapists. I'd like you to sort of listen in to see how one therapist trainer would talk to other therapists in terms of what they think about and what to consider when they're in the midst of engaging in their therapy. I think it's informative for you to see this perspective. You know, maybe some of you will want to become therapists. I also want to just highlight, here's a type of therapy that I really like. It's called acceptance and commitment therapy. And so there are many, many different types of therapy. I just happen to like this one. I like it because it focuses on accepting your disturbing thoughts as mere events of the mind. It's sort of a mindfulness approach. Like, here comes a thought. Oh, is that real? I just accept that that's just a thought. It comes, it goes. And as I'm in the middle of this struggle of say, my anguish or my depression or my anxiety, one of the things that this type of therapy asks of me is to keep a focus on what I'm committed to. It presumes that remember what's important to you. What am I committed to? I'm committed to my marriage and the happiness of my husband and the success and happiness of my son. I'm committed to kindness. I'm committed to my health. You know, it could be anything, but there are certain things that are important to you. And so when you're in the middle of struggling through something, reminding yourself that you are committed to these things can be an incredibly useful path forward. Also, there's a video for this one if you want to hear somebody talk about this type of therapy. Behavior therapies are largely about learning, right? Remember, we had that whole chapter on learning and classical conditioning and operant conditioning and modeling. Behavior therapies are largely making use of this insight. So in behavior therapies, you're relearning, you're reshaping your expectations. If this happens, then that will happen. So you may have learned that if you do bad on a test, your parent, everything will go to crap. You may, because you came home with I don't know, a D and your parents are freaked out. So you may have had a very aversive learning that now you're so anxious and stressed about that thing happening again. Maybe there's a way that you can relearn. Maybe that won't happen every time. So behavior therapy helps you relearn it, and it helps you to adopt new behaviors. So it sort of starts with behave differently and then you will feel differently, right? So it sort of starts with what's out and about in the surface of things instead of what's underneath it all. So if you behave differently, you'll start to feel differently. So some types of behavior therapies that depend on classical conditioning are systematic desensitization. So for example, if you're afraid of spiders, there's a whole hierarchy. There's a whole specific repertoire of treatment that you can go through that you just start out with the shadow of a spider, and then maybe you work up to the image of a spider. And what's important about this is that you have mastered relaxation techniques, that every time you expose yourself to one incrementally more threatening stimuli, you're actually actively undergoing relaxation. So you're relaxing yourself in the face of threatening stimuli. Aversion therapy is another type of, would this maybe be operant conditioning? Probably. So I have this picture of this poor little kitty being sprayed with with water because I don't know what the poor little kitty was doing. Maybe she was on the counter. That's one way that people say, hey kitty, if you're going to be on the counter, I'm going to spray you with this thing. And so maybe then kitties learn to stay off the counter. But as we all know, cats will just get on the counter when we're not around because they're smart little devious creatures. But another type of behavior therapy is modeling. So remember the Bobo doll, and remember the fact that we learn to behave in certain ways by watching how other people behave. That's another way that we can treat ourselves through our problems. And one of my favorite examples of this is the treatment that a lot of people use for their alcoholism or addiction. They go to 12-step meetings. And a huge aspect of 12-step meetings is you show up in a room full of people, most of whom are recovered, and they are modeling for you the type of behavior that is required for abstaining from drinking. And so you're not out on your own just dealing with your inner feelings and struggles, but actually now you're faced with a craving and you think you want to do something. Now you have a whole repertoire of behavior that has been modeled for you by these other people that you've been sitting with every week, and you can make a different choice. So behavior therapies are most successful in treating phobias, like that would be systematic desensitization, OCD also, sexual dysfunction, autism, eating disorders, and delinquency. I also want to just do a shout out to dialectical behavior therapy. I've been reading a lot about it these days, and it's just like really floating my boat. Um, and so here's a link to more about it, but it basically has four main principles. It says if you develop and it's trying to help people with borderline personality and or emotion dysregulation. So we've talked a lot about how some people sometimes have a hard time regulating their emotions. Their emotions are just too big for them. And I've identified myself as someone with big emotions. That's probably why I like this therapy. But it's emphasizing core mindfulness, meaning just take it as it comes. Let it come, let it go. Breathe and be still. Notice what is. It also is emphasizing distress tolerance skills. It's what do you do when you're so upset you think you're going to just explode? Actually, there are some things you can do involving holding some ice or or distraction so this identifies the skills that are associated with just comforting yourself that it will pass. There are interpersonal effectiveness skills. One of the biggest painful things in life is interacting with other people, being disappointed in others, having them put us down or thinking that they're putting us down or neglecting us or they didn't call, or there's so much pain associated with sometimes friendships, sometimes relationships. And so if the bosses, coworkers, if this is something that is a constant source of distress for you, this particular therapy focuses in on ways to get what you need with other people in healthy ways, and then emotion regulation skills. There's a biomedical approach to treatment, and this is where the pills come in and other things, but psychopharmacology is what we call using drugs to treat the symptoms of psychological disorders. So, among the psychotherapeutic drugs, there are basically four different types. There are anti anxiety drugs, which reduce arousal. There are antipsychotic drugs, which decrease dopamine in the brain. There are mood stabilizing drugs, which reduce emotional intensity. And then there are antidepressant drugs, which balance various neurotransmitters. And so here's a chart where you can read more about them, and you'll read more about them in the chapter. We also spent some time when we were studying consciousness, and we read about psychedelics as a way to treat psychological disorder. In fact, we listened to a radio program about MDMA as a possible way to treat PTSD, among other things. And why is this so interesting? Because these types of drugs are non-addictive. They're not stimulants. They don't cause energizing feelings. They're not opioids. They don't make you relaxed and dependent on the pill to get to this relaxed state. Psychedelics cause an altered consciousness like trance or meditation or ecstasy or dreaming. And in this altered consciousness, it can actually reshape some of the basic assumptions about your life or life in general that are at the very core of your psychological distress. That's why I think they're so interesting. Other biomedical approaches include electroconvulsive therapy, that's shock therapy, psychosurgery. Remember, we talked a little bit about the lobotomy, but there are other forms of surgery that can be used. And then a magnetic treatment, transcranial magnetic stimulation, which actually to me is interesting because there's no long-term damage association, and they find that this is effective with some people with depression who have been unresponsive to any other treatment. It has helped some people. There are many other types of therapies: group therapy, self-help, couples, family therapy, telehealth, which is now all therapy really because everybody's got to be over the computer. There's art therapy, music therapy, compassion focused, etc. So if you think you might benefit from therapy, don't just try one. You don't know what's going to be the right one to help you. You want to if you or someone you love needs therapy, be a very, very assertive, aggressive consumer. Look and look and look again. Don't give up on the first 2 or 3 that you try, because the right one for you is probably out there. In terms of one of the things that our book likes to do is to look across cultures, and what across all cultures is common when we think of successful therapy. One thing that is very helpful is naming the problem. A lot of people who suffer, they are very benefited by just having a name for what it is. They can categorize their feelings in some way. They can categorize their experience. Another one is having caring, competent, trusting relationship with a therapist. That's super duper healing and bolstering and confidence building. Having an established credibility, so that it's not just someone random helping, but they're actually credible with some sort of field or background or discipline that supports their interactions with you. A familiar framework, techniques that bring relief. So therapy works if relief happens. You start to behave, if your anguish goes down, or you're behaving in a way that's more consistent with your values, all of these things. And also having a special time, a time away from the hub of it all, a special place, a face-to-face. These are all things that help with a successful therapy. And I'm almost at the end. And I came across this as I was researching this lecture, and I'm going to give you a link to it. I really want you to watch it because it's fascinating. It's avatar therapy to help those who hear voices. So within schizophrenia, as you know, people suffer from hearing voices. And this is a particular therapy that was developed where they create an avatar for the face that the patient thinks goes with the voice that they're hearing. And then they create a voice that it sounds like the voice that's in their head. And then the patient sits and talks to the avatar who has the voice. So the voice might be saying, Hey, dummy, you're fat and no one's ever gonna love you. And meanwhile, the therapist who's is coaching the patient to confront the voice and say, actually, no, a lot of people love me, right? You'll see in the video, but it's really interesting and it's fascinating to think about using the innovations of technology, you know, so here we are with this belief that maybe as individuals we're always growing and we're always becoming better. Certainly within the field of psychology, what I can see is that we're always growing and we're always becoming better. And we're using our new knowledge to try new things to help people in new ways. So you may want to take some of this knowledge and go into a mental health profession. For example, there's clinical psychologists, counseling psychologists, pastors, school psychologists, psychiatric social workers, psychiatric nurses. Now, there's an idea, right? I know a lot of you are interested in nursing. But now, this is the last slide of my last lecture, and it's just a moment for me to stop and reflect on how beautiful the scientific study of mental process and behaviors is. Psychology is beautiful in my opinion, and I hope that you've gotten a little bit of that feeling during this class. So I'm not going to play this video for you, but it's simply a video of a soap bubble that's taking about 30 seconds to turn into a crystal, to freeze into a crystal on a cold, snowy day. Why do I think this is an image of psychology? Why do I think this is an image of mental processes and behavior? I don't know, but it captures some sense of how delicate and beautiful and even like powerful and strong, even. It's delicate and strong at the same time. Anyway, I think it's a beautiful image, and I thought I'd use that to end the course with. And I'm so glad you came on this journey with me, and I hope you had a good time.